So pertussis is another disease that we now have a vaccine against, and it's also known as the whooping cough. I think most people have probably heard of the whooping cough. Outbreaks were first described in the 16th century, but because it's such a fastidious organism, it really wasn't until the early 1900s, 1906, until we were able to isolate the organism. And it's a gram-negative rod. It requires a special media for growth, which is why it was hard to isolate. And humans are the only host of Bordetella pertussis. Transmission is by close contact with aerosolized droplets. And this is another toxin-mediated disease. So the toxin paralyzes the cilia, so the little hairs of the respiratory epithelial cells. And you get inflammation and then the inability to clear your pulmonary secretions. Those of you who've studied this know that the classic disease in older children and adults usually occurs in 3 stages. So you have first the catarrhal stage, and that lasts usually 1 to 2 weeks. You have some mild upper respiratory symptoms and maybe a low-grade fever. And then you have, after that, the paroxysmal stage. So this is what I think most people classically think of as pertussis, where you just have the paroxysms of cough, classically with an inspiratory whoop, and then often with post-tussive emesis. So you cough so hard that you throw up afterwards. Children, are always a little bit different in how they manifest this disease. They might have cyanosis during their coughs. They might look a little blue around their lips. And they look really, really tired afterwards because it just requires so much energy. But they can be asymptomatic between and look very normal. So most, in the paroxysmal stage, most of the episodes of coughing actually occur at night. So this can last up to 6 weeks and even up to 10 weeks. Usually resolves within 6 weeks, but sometimes up to 10 weeks. And then, so you have the catarrhal stage first, and then the paroxysmal stage, followed by the convalescent stage, which lasts about 2 to 3 weeks. And that's just as the cough improves and the symptoms wane over weeks to months. And, in an adult or an older child, this can actually look very, very impressive. I actually recently took care of a teenager who he was getting an endoscopy because for vomiting, and they couldn't figure out why he kept vomiting, and it turns out he actually had pertussis. So the vomiting was always after coughing, but people didn't associate that. They just noticed, they just knew that he would have these what seemed like random episodes of vomiting. And he tested positive for pertussis. We actually did the pertussis swab after he was already under anesthesia, so then all of us had to have post-exposure prophylaxis, because this is one of those illnesses that even though you're vaccinated against, it's hard to maintain that immunity.
So question in my mind, if nobody was suspecting that this may be pertussis, how did you end up approaching that path?
Someone, because I think in the history there was, someone did mention, oh, he has also been coughing, but the family felt very strongly that it was not exclusively associated with cough. The vomiting was not exclusively with cough. But because he did have these episodes of cough, someone thought, oh, we should test him for pertussis. And for whatever reason, the swab wasn't done until after he was under anesthesia. And so I was wearing a mask, and usually we wear a mask when we do anesthesia, but I think a lot of people were exposed to him, and it's sort of a public health problem for the hospital once somebody is diagnosed pertussis positive, because they need to go back and track all the people who took care of the patient, or if he was in a room with another patient, and make sure that those people are aware and take prophylaxis if necessary.
Got it. Very interesting.
Yeah, it was an interesting case, I thought. So Unfortunately, pertussis can cause very severe disease in infants under 6 months. So the two top photos are these sad pictures of little babies who have pertussis. And the top picture, the child is intubated, so has a breathing tube, and then has a tube in the mouth, which is probably to suck oral secretions, and then a tube in the nose for feeding, and has a monitor on the forehead to measure like cerebral brain perfusion. And you can see the bottom picture, the baby's getting supplemental oxygen, also has a tube in the nose for feeding. So it can cause, very significant disease in infants. I've even taken care of a patient who had to be on ECMO, so they put on the heart-lung machine because the lungs were, the baby was so sick and not able to breathe and oxygenate well. And they knew that if we could kind of get him past the significant part of the disease, that he would survive. So they put him on the heart-lung machine, and that was for pertussis. So kids, babies typically have a very short first stage. The catarrhal stage is very short. And then because they don't have good, strong muscles, they're not able to whoop. And so you might not kind of have the classic symptoms. They might just gag or gasp, or they may just stop breathing. And when you're a small infant, when you stop breathing, you often have a drop in your heart rate too. You can also develop a secondary bacterial pneumonia, as well as you can develop pulmonary hypertension, so increased pressure in the lungs, which can then make it difficult for your heart to pump blood forward, and sudden death. So it can really affect infants in a very significant, profound way.
Very interesting. I never was able to connect that. Why is a baby not able to whoop? So of course, if the strength of the muscles is not good enough to create that.
Right. You're not going to get that sound.
Yes.
In children and adults, you can have, just from how severe the coughing is, you can develop a pneumothorax, you can have nosebleeds, you can even develop like hernias and rectal prolapse just from the pressure of the very intense coughing. And then obviously if you're young and you develop hypoxia, then you can have seizures and encephalopathy from that. And so although we do immunize against this, unfortunately, you don't develop a lifelong immunity from either infection or immunization. So, you can get the disease and it doesn't mean that you'll be immune. And, we immunize and it doesn't mean that you'll maintain immunity. So that's why the booster is so important. So when we realized that a lot of adolescents and adults were getting pertussis, and it was because the immunity wore off, that's when they developed the Tdap vaccine, which there was this big public health push to make sure that people got. So the actual pertussis vaccine was introduced in the 1940s. And before that, there were over 200,000 cases reported every year, and that was with a much smaller population of maybe 130 million back then, and now we have over 300 million, so that proportionally would have been probably like 500,000 or more cases per year. And with the vaccine, we've decreased the incidence by 80%. But unfortunately, in 2012, we had a resurgence, and there were 41,000 cases reported, which was the highest in 50 years. So that's why there's been such a big public health push to make sure that everybody receives the booster vaccine of the Tdap. And that the cartoon on the right is one of many, many sort of public health outreach efforts.
Very interesting.
Guys, thank you very much for watching. Make sure that you like, subscribe, and share this video. Like it if you like it. If you don't like it, then don't like it. And then subscribe if you want more videos. We upload videos regularly, so if you subscribe to the channel, you can get a notification and the video will appear in your inbox. And if you hit the bell button as well, then you can get the notifications for this as well.